Hello, I'm Dr. Nicole Alexander-Scott, the Director of the Rhode Island Department of Health and the President of the Association of State and Territorial Health Officials, also known as ASTHO. ASTHO is the national organization for the health director in each state and territory across the country. Today, I want to talk to you a little bit about why it is so important that we invest in public health interventions in our communities so that we can address the underlying factors that have the most significant impacts on the health of us as individuals, on the health of our families, and on the health of our neighborhoods and communities. In Rhode Island and across the country, health departments are starting to take this talk about the importance of investing in health at the community level and are putting it into action. This is our opportunity. At ASTHO, our vision is for all states and territories to be supporting each other and learning from each other in this work to ensure that everyone has an equal opportunity to be as healthy as possible, regardless of the zip code they're from. Also, regardless of their race, ethnicity, sexual orientation, gender identity, level of education, level of income, or insurance status. That's why we are so excited about this current ASTHO President's Challenge, which is an initiative that all health directors will be working on together across the country. ASTHO's current President's Challenge is focused on building healthy and resilient communities. I'll come back to the President's Challenge shortly, but first I want to give a little more background to get us started. For the first time in 50 years, we've seen a year-over-year decrease in life expectancy in the U.S. That shouldn't happen. We need to be able to tell our children and grandchildren, you're going to live longer. And everyone in the country is looking to public health to make a difference about it, and we have that opportunity. We can also learn from other countries. We see how much we've spent on healthcare where other countries haven't spent as much, and other countries have life expectancy going in the right direction over the course of years from 1970 until 2014. This next slide also shows some of those developed countries have figured out what to do differently. When you look at the blue part of the bar, that highlights how much countries spent on health care. And the U.S. is circled red, and we have the highest blue bar of any other developed countries. We're spending, based on that graph, something like 75% on health care. The red part of the bar highlights social services, investments in the community, a focus on prevention, ambulatory primary care, and addressing determinants of health. Other countries have realized there needs to be a better ratio on investing in communities and addressing determinants of health than investing in health care the way we do. Here's the last way to really highlight that. This graph shows all of the different ways that determine how healthy someone is. Only 10% is made up of clinical care. What happens in the clinical care setting only makes up 10% of determining how healthy someone is. There's another 10% for genetics, and the remaining 80% is where health outcomes come from. Social and economic factors, physical environment, and the healthy behaviors that are influenced by both of those. So as public health, we need to figure out ways to shift investments from too much in that 10% for clinical care and more into the 80% that determines how healthy we are. And that happens where community is. That's why at the Rhode Island Department of Health, this is our strategic framework. By knowing we need to shift investments from clinical care setting, primarily high acuity care that's costly, to prevention-oriented primary care, community services, we have three leading priorities for accomplishing that: addressing social, economic, and environmental determinants of health, eliminating disparities of health, and promoting health equity. So regardless of the zip code you're from, you have access to living the healthiest life you can live in the healthiest community. That's achieving health equity. and ensuring access to quality health services for all, including our vulnerable population. In Rhode Island, we've chosen a successful, innovative, community-led, place-based approach for doing that. We know one route to go is through the clinical setting and getting the clinical setting to turn more towards the community. There are a number of initiatives nationally where that's happening. CMS, State Innovation Model Test Grant, our Accountable Health Communities, CDC's 618 initiative, a lot of the good work that our ASTHO Center for Population Health Strategies is doing. What we also want to do, and that's a focus for this President's Challenge, is figure out also how to go directly to the community to shift the investments. Communities have strengths and resources, and they know what they need to improve their living conditions. So in Rhode Island, we created the Health Equity Zones Initiative as a community-led, place-based approach for allowing the community to lead the way in making the difference. By aligning strategic investments with the existing resources in the community, public health can support communities in making the differences that they need. With the Rhode Island Health Equity Zones, there are core principles that are in place to drive lasting community improvements. Governmental public health serves to support the community in leading the way to organize a collaborative of diverse partners from the community's self-defined zone, ranging from the size of a neighborhood to the size of a county in our state, pulling together those from all sectors, especially including the residents of those communities, and then also supporting them in doing a community needs assessment to address the conditions in their community for better living, and then to create a plan of action that's targeting measurable objectives based on effective strategies shown to be successful. And the key public health principle added to that is to support the community in evaluating their outcomes so that improvements can be made to keep moving the mark. That's the foundation for what we're hoping to achieve with the President's Challenge, building healthy and resilient communities. Let me talk a little bit about the challenge. For the first time, we are aligned with the National Association of County and City Health Officials and the U.S. Surgeon General's focus on community health and economic prosperity. As state and territorial health officials, we have a key role to play in elevating communities and making sure they have the support they need. We also recognize that NACCHO is equally as critical. And of course, our colleague, the U.S. Surgeon General, who's really making a mark in terms of promoting economic prosperity and the importance of the corporate sector investing in the communities that they are in. We want to call on public health officials to change how we work with communities and change who our partners should be. That's how we're going to build healthier, more resilient communities and support investments in those communities. So there are two major goals with this President's Challenge. The first we want to do is provide tools to equip health officials with mobilizing the community-led place-based models that exist in your jurisdiction. We have the Rhode Island Health Equity Zones, there's purpose-built communities in Georgia. Fort Worth, Texas has the Blue Zones Project, and Live Well San Diego, and several others, all of which allow for tapping into the strengths that exist, organizing to bring the community together and establish an infrastructure that will give the community the voice they need to change systems and to transform policies. The second major goal taps directly into our Surgeon General's focus on community health and economic prosperity. We want to connect public health officials by reaching across sectors to the corporate world, our corporate partners, business leaders, and policymakers who want to and should invest in these community-led, place-based approaches so that we can advance economic development. By doing this and strengthening community-led, place-based approaches through strategic investments, We can also highlight 2 additional elements of the President's Challenge. We will promote positive social connectivity. It's so important. How often do we remember growing up in a neighborhood where you knew each other and families supported each other? Social connectivity is a public health issue, and we need to bring that back and make it front and center so that we can better combat addiction, emotional suffering, and the isolation that's occurring in this day and age. We have an expert that we love in Rhode Island named Jonathan Goyer, who serves on our governor's overdose prevention and intervention task force. And his prominent phrase that we oftentimes repeat is the opposite of addiction isn't just sobriety, it's connectedness and coming together. And that's going to be prominent with this President's Challenge, building healthy and resilient communities. The last is just improving community resilience and having an understanding together of what that means. We want to support communities in being able to bounce forward after a disaster, not just bounce back, but to improve and remove disparities that exist and give communities the strength and support to resist, respond to, and recover from everyday adversities as well, like adverse childhood experiences, and even infections or other diseases that plague communities disparately more than others, like HIV, hepatitis C, and other STDs. Community resilience gives the community the opportunity to stand up, have their voice on their own platform, and drive the systems and policy changes that they know they need for better living conditions and to have the conditions for success. Together, we can implement both of these President's Challenge goals by supporting outcomes-driven, community-led, place-based approaches and attracting diverse investments from business leaders and policymakers who can help sustain community transformation over the long term. This way, we will have ready-made, community-led collaboratives that can be invested in with the opportunity for diverse partners calling for community development and strength and not community displacement. We have our own role to play, and I'm so excited to embark on this journey with you.